The fellowship year is very important to, get your hands on and do a high volume of cases so that when you finish that year and you start your practice, whether it's in academics or private practice, you'll be able to have the skill set needed to do proper surgery and help people.
When I interviewed with Dr. Morrey, I really liked everything that he was, saying about what the fellowship was going to be. It was everything that I was looking for. He always talks about a real-world fellowship and something that, to make sure that you're as prepared as you can be for the practice that you're going to go into.
From day one of fellowship, we had immediate autonomy, whether it was on the clinical side in the office or in surgery in the operating room. And that's something that's important as you search for a fellowship, because you want to fine-tune your skills and come out prepared and being able to tackle a lot of the things that you're going to see when you're out on your own in practice. And that's been one of the important things early on for me.
One of the other aspects of the fellowship that make it the greatest fellowship in the country is really that you get the opportunity to work with literal giants in the orthopedic community. Dr. DeLee wrote the textbook on sports medicine. He did a fellowship with Charnley. He worked with all of the guys of the textbooks that we know of. He worked with Rockwood, he worked with Green. Similar with, Morrey Sr. was a chairman at Mayo, invented one of the Mayo short hip stems, invented the Morrey approach to the elbow and the Morrey total elbow arthroplasty. And so to be able to just pick their brains, because they've seen it all and they've done it all, is something that you're not going to get anywhere else.
Not only do they do good surgery, but they also take care of their patients and make sure they're doing everything that they can to make sure everyone has the best outcome possible.